Welcome to The Explainer. Today, we're going to talk about something super common but often misunderstood, a condition a lot of women face, pelvic organ prolapse. We're going to break down what it is, why it happens, and most importantly, what you can actually do about it. So let's start with a feeling that might be, well, a little too familiar for some of you, that something down there feeling. It might feel like a heaviness or some pressure, maybe even a distinct bulge in your pelvic area. If you've ever felt that, I really want you to hear this. You are absolutely not alone. It's one of the most common ways women describe those first signs. And look, I get it. It can be really unsettling. But this experience actually has a name. And just understanding what's going on is the very first step toward feeling better and taking back control. Okay, so what is actually happening inside the body to cause these feelings? Let's get into the mechanics of it. I want you to picture your pelvic floor kind of like a strong, supportive hammock made of muscles and tissues. It holds all your pelvic organs perfectly in place. Well, pelvic organ prolapse, or POP, happens when that hammock gets weakened or stretched out, letting one or more of those organs drop down. And that's what creates that feeling of pressure or bulging. And the symptoms aren't always what you might expect. For some women, it's just this persistent ache. For others, it might show up as, issues with your bladder or bowels. These are all signs that your internal support system isn't working quite the way it should be. So, of course, the next big question is why? Why did this happen to me? It's a really common and totally understandable question. So let's dig into the things that can contribute to it. The thing is, there's almost never just one single cause. The incredible pressure from pregnancy and childbirth is, for sure, a major factor. But so are the hormonal shifts that come with menopause, or chronic straining, or even just the natural aging process itself. For most women, it's really a combination of these things over time that weakens that pelvic floor.
But here is the really great news. You do not have to just live with these symptoms. There is a super effective, non-surgical way to find relief that actually gets to the root of the problem. This is so important to understand. Before even thinking about more invasive options, specialized physiotherapy is the recommended first step. Why? Because it's designed to strengthen that internal support system we were talking about, that muscular hammock.
And it's a whole body approach. We're not just talking about doing Kegels here. It's about retraining your entire core system, strengthening the right muscles, learning how to manage pressure when you're just going about your day, and ultimately making those symptoms way less intense so you can get back to living confidently. And this is huge. Seriously, getting this kind of conservative care early on can be enough to manage the whole situation effectively. It often helps women completely avoid the need for more invasive procedures down the road. So that brings us to some real-world, practical questions about daily life, because getting a diagnosis like this should not mean the end of your active lifestyle. This is such a big concern for so many women. You're probably wondering, do I have to give up running or lifting or all the activities I love? The answer is a definite yes. You can exercise. But the key isn't to just push through the discomfort. It's to get expert guidance. A pelvic floor physio can teach you exactly how to modify movements and use the right breathing techniques so you can stay active safely without making your symptoms worse. Okay, so with all this info, how do you know if it's the right time to actually reach out to a specialist? Here's the bottom line. If any of these symptoms are getting in the way of your daily life, it's time to get some help. You don't have to wait until things get really severe. The sooner you get an assessment, the more effectively you can manage everything and just improve your quality of life. Remember, the whole goal of treatment isn't just to manage a condition. It's about education, it's about empowerment, and it's about getting real results that let you feel strong and confident in your body again. Just so you know, this entire explainer was created using fantastic information from the pelvic health specialists at OVA Women's Health. They have deep expertise in managing and treating this condition with a ton of compassion and evidence-based care. So if any of this resonated with you today, I really want you to know there's a clear path forward. Taking that next step to get a personalized assessment, it's honestly the most powerful thing you can do. Your pelvic health is just way too important to ignore.